Hello there, I'm Martin Kentish, Managing Director of Free Range People. We're the people behind Health Feedback, which is a system to deliver patient insight, including NPS, to the health sector. We've got about 15 years' experience of deploying successful NPS solutions to the commercial and public sector. Companies include Tesco's, John Lewis, McDonald's, and NHS organisations like CEPT. What we'll be going through in the presentation is a quick overview of NPS itself, and then go straight into ways of implementing it. If you want further information, please visit the healthfeedback.co.uk site or contact me directly, martin@freerangepeople.co.uk. The essence of NPS is a single question to rate a patient's enthusiasm to speak highly of a service on a 0 to 10 or 1 to 10 scale. Now, the people who score 6 or less to this question are called the detractors. These are the people who may actively share a negative experience about the service they receive to friends and family. People who score 9 or 10 are called the promoters. These are the people who actively share a positive experience with friends and family. A third group, called neutrals or passives, do not feel strongly enough about the experience to make a positive or negative recommendation either way. The net promoter score is simply the percentage of promoters less the percentage of detractors. If we also invite patients to comment on their score, we receive a good indication of the factors that have affected that score and provide a valuable basis for acting upon the results. So, in this example, if we sampled say 1,000 people and 20% were detractors and 60% were promoters, the NPS score would be 40%. Even though NPS itself is very straightforward to understand, there are still some hurdles to overcome. Understanding how NPS is practically deployed within a busy operational environment may require additional skills that you don't already have. Secondly, you may not have the IT infrastructure to capture, deliver and report upon the response that you get. And if you don't consider these carefully, you may end up with a system that further increases the workload on an already busy staff. You may find it very difficult to produce live reports because workload to do so simply piles up. But lastly, and very importantly, nothing changes. Whatever investment has been made could be wasted because people focus on the mechanics of collecting and reporting rather than the actions that lead to improvements. So consider Health Feedback as a toolbox, providing a complete, adaptable solution with all the consultancy and IT tools to make a successful NPS project. So everything is handled for you, the consultancy, the design, the capture, delivery and reporting. So you don't need to install anything or purchase any new devices to use it. So a typical system in 5 service areas can be up and running within a week with minimal training requirements. In terms of implementation, the design thinking behind it was to develop a system that would make it very straightforward to establish, use and expand NPS within any organisation. This includes all the technology to give an organisation the freedom to focus on patient engagement and acting upon the results. Secondly, the system needed to be fast to implement and deliver results in a short space of time. Both these design goals have been achieved, so an NPS solution can be up and running in a matter of days and deliver results in real time. The first step in an NPS solution is to engage the patient and encourage them to respond. In this feedback card example, an attractive front page encourages the patient to understand why they're being asked and what happens to the results, and gives them the freedom to respond in a way that is convenient to them. For example, the patient may respond using a simple URL that takes them to a web page dedicated to a particular service. Patients may also respond via email, with the score placed in the subject line and their comments within the email itself. SMS text messaging may also be used, perhaps more suitable to the younger audience. The score is placed at the end of the text and the health feedback system extracts this automatically. Fourthly, a dedicated call centre provides the opportunity for patients to phone in their scores via a suitable free phone number. Smartphones may also be used via a suitable QR code, which takes them to a suitable electronic feedback form hosted at healthfeedback.co.uk. And lastly, probably the most popular, patients have the choice to complete and tear off their response on the card itself. This is returned to us via free post and entered into the database manually. Whichever method is used, all the response handling is made by the health feedback system, storing the results in a secured database automatically. So here are a few examples of what the feedback looks like via an iPad, which could be used on a customer visit, also showing what it looks like on a smartphone or via text. By giving patients the freedom to respond how they wish and supporting all methods of response, staff do not require specialised devices to gather patient feedback. Once the response is received, we've got the freedom to determine how it's processed. For example, the patient can receive an automatic acknowledgement telling them who has received their views. That feedback can then be instantly delivered to the appropriate member of staff via email. Within this email could be the opportunity to respond to it, e.g. recording what actions are taken or even sending an individual message to the patient if required. As all information is captured in real time, so we can grant staff controlled access to the results through an online dashboard. Staff are granted access to the responses that are appropriate to their permissions, so a senior manager can see NPS scores for all services, but a service manager is restricted to see just their own. In this sample report, we've chosen to graphically display the NPS score, the average and a breakdown. Also shown are the comments broken down into promoter, detractor and passive comments, which is useful for understanding what is going well and what can be improved. Now these reports are completely configurable, so we can, in another tab, display a list of patient comments against staff actions, which may be a good way to understand what impact a customer comment is actually having. We said at the start that one of the key thoughts in the design of the solution was simplicity, and we've carried this through to how it's actually implemented. In order to establish an NPS project for a particular client, all that we require is a list of service areas that are participating, so that we can attach a code to each patient response that drives suitable delivery and reporting. Secondly, an understanding of what you'd like to do with the response when it arrives, such as deliver it automatically via email. Thirdly, we need a decision on who needs to access the dashboard to view the reports. Fourthly, an agreement on the invitation itself, such as the design and branding of a feedback card. Then the rest is handled by us. Staff simply hand out the card and view the results. It means that there is virtually no staff training required, no software or technology needs to be installed, so it's made very simple for everybody to implement and to use. So to finish, health feedback is a solution to simplify and accelerate the deployment of a successful NPS program, removing any complexity and granting staff the freedom to use the results without having to worry about how it's implemented. Thank you very much. If you've got any more comments, please get in touch. Thank you. Bye now.